the face. So, my dear friends, look, you can see, wait 1 minute, back, верну немножко. So, look, my dear friends, interesting situation. In this case, you can see defect into skin with irregular oval form, with small size, without defect minus tissue, but look, edges of this injury go inside, into wound canal inside. And look, in lower parts of this injury, you can see abrasion zone. Look, with dark red color in this place, present trauma of epidermis, abrasion zone. And my dear friends, look, you can see around of this interesting tattoo sign with dark red color, black color tattoo sign. This effect action or this result action of a components of a shot. And my dear friends, in this situation, you can see example with non-perforating gunshot injury because present only entrance wound. Why is this injury named entrance? Because this injury have a small size, no regular oval form. Next, edges go inside into wound canal. You can see abrasion zone, and you can see a components of a shot around of this injury. And the exit wound in this situation is absent. Bullet locate under skin in soft tissue of the face. And I repeat, this non-perforating gunshot injury of soft tissue of the face. In this situation, bullet have kinetic energy between 10 and 100 joules. This cuneiform action. Remember, why cuneiform? Because regular form, because abrasion color, and the present and the edges go inside. Next, distance of shot. In this situation, you can see example with close distance, because all accompanying components of a shot locate on surface of the skin around of entrance wound. So, look, my dear friends, defect into skin. In this situation, shot was under acute angle because look, abrasion locate into low parts of the entrance wound. Entrance wound have oval form, and look, in upper part of the entrance wound on the skin, you can see deposit of soot. As a result, shot was under acute angle. In oral cavity, present sign of bleeding. Patient is worried, нервничает. So, research. Oral cavity, examination of oral cavity may be present exit wound in oral cavity.
Ma'am, is this patient alive?
Yeah. And this moderate trauma. This patient in state of shock. So research oral cavity. Exit wound is absent, No, strong man, yes. Look next, examination of wound canal, and in wound canal present bullet. In this situation, you can see result action of cuneiform cuneiform action of a bullet. And remember, my dear friends, if take cuneiform action, kinetic energy maybe 10, yes, between 10 and 100 joules. In this situation, kinetic energy was very small, maybe 10, maybe 20 joules. As a result, bullet like it penetrate only in soft tissue and like it under skin. This is not mortal, non-mortal trauma. Non-mortal, this is anti-mortal trauma. So next, as if for me, I'm not at a gunshot injury my topic. Я люблю эту тему. So next video, more interesting for men, I think. So remember, in our classification, distinguish few groups of firearm. Firearm can be, if take a mechanism of shot, automatic, next semi-automatic, and non-automatic. Now I show work and the structure of automatic and semi-automatic firearm with mechanism of shot. Wait. So now I try open this information video. So now as example, automatic firearm, automatic device, this AK-47. Simple structure. Magazine. Hit. Primer, which like it in cartridge case. In primer present specific substance. Notice forms part. Gunpowder is burns, is formed to powder gases with bullet from outside, and the lock with vulnerable outside accompanying components of a shot. Cartridge case back, да, возвращается. So continue, repeat mechanism. Automat Kalashnikov have two types of work. Look next, second type. Weekly shot. In magazine of AK-47 present 30 in magazine, present 30 to 32 cartridge, battle cartridges. So next video with semi-automatic
I created this.
Wait. Не спеши. So
I created this animation in order to explain how firearms function in a very basic, clear way, which requires no previous knowledge. The firearm used as the model, a 1911 semi-auto handgun, will be displayed with only some essential internal parts for the sake of simplicity and clarity. This is an individual unit of ammunition, the cartridge. It is loaded into the magazine, which contains a follower and a spring that keep the cartridges under tension. The magazine is designed so that the cartridges can only be pushed out forwards. The spring cannot push them straight out of the magazine. When pulling the slide back, it cocks the hammer. Upon releasing it, the recoil spring slaps the slide back forwards, which on its way grabs a cartridge and pushes it into the chamber of the barrel. When the trigger is pulled, the hammer drops and strikes the firing pin, pushing it forward. The cartridge consists of a casing, which contains the bullet, the powder, and the primer. When the primer is hit by the firing pin, the chemical reaction inside causes a small explosion which ignites the powder. The powder burns rapidly, which increases the pressure within the enclosed cartridge dramatically. The resulting force propels the bullet, while equal force also goes in the opposite direction, pushing the slide back, which ejects the spent casing and cycles the next cartridge.
So, no, as for me, this interesting, interesting video, my dear friends. Now, continue work with situational task.
Task 1, right? From a case history, it is known.
Dr. Amin, present now?
Yeah. Hello, ma'am. Can you hear me?
Dr. Amin, please read task number 1. Read task number 1.
Okay. From a case history, it is known that a citizen K, aged 16, was admitted to the surgical department on September 20 at 4 p.m., where in 5 hours had died. Clinical diagnosis: blind firearm wound of the chest, penetrating into the abdomen with impairment of internal organs. There look place impairment of liver and stomach, internal bleeding and shock. On forensic medical examination of cadaver, it was revealed under the bandage along the median line there is a surgical incision which passes from Sifford process up to the pubis. From the right at the level of ninth rib along the posterior axillary line, there takes place structural failure of the skin with the length of 3 centimeter at reduction of edges of which is noted a tissue defect with a diameter of 0.5 centimeter, round in shape. The edges of the skin around the wound is 0.3 centimeter of width, are grayish and have a form of dirty red colored ring. And in the underlying tissues, there takes place hemorrhage. The wound penetrates into chest cavity along the less curvature of stomach from the behind in front, and there are 5 surgical stitches. Surrounding underlying soft tissues are saturated with dark blood. 400 milli of fluid blood is in the abdominal cavity. On the skin, there is an oval-shaped tissue defect. Wound edges are saturated with a dark blood. Wound canal is interrupted in the right costodiaphragmatic recess, passes through the diaphragm. From the right penetrates the posterior right border of the liver, posterior wall of the stomach along the lesser curvature, interrupt the abdominal cavity and coming through the anterior wall of stomach and ends blindly in the abdominal cavity. Lesions of the kidney and the liver are the irregular radial form with the irregular saturated blood edges. The bullet was extracted from the abdominal cavity. On autopsy, there are revealed anemia of inner organs.
So, Dr. Amin, now I give you few minutes. Read next question. Type of gunshot injury, perforating or non-perforating. Next, specific signs for entrance wound and exit wound if perforating. Next, distance of shot and the type of firearm, battle or hunting. So I give you a few minutes. Think. Then we give me answers on my questions.
Last question, ma. Last
So
question. Type of last question.
type of gunshot injury. Remember, perforating or non-perforating.
Okay.
Next, specific signs of entrance wound.
Okay.
Next, distance, contact, close or distance shot.
Okay.
And the type of firearm, battle or hunting.
Okay, ma. Okay.
So, my dear friends, as the students ready, Dr. Krishna, ready answer task number 2. Dr. Thompson, ready task number 5. Dr. Hisham, task 4. Dr. Jones, task 6. And Dr. Arvind Khan, task 9. Please ready? Ready answer. Ready. So
task, which task?
now I repeat. Dr. Krishna, ready task number 2. Next, Thompson, task 5. Hisham, task 4. Jones, task 6. Dr. Arvind Khan, 9. Task 9. Please read and ready answer. So, Dr. Amin, are you ready?
Yes, ma.
So, first question. Name type of gunshot injury. What do you think? In your task, present example with perforating or non-perforating gunshot injury?
It's non-perforating, ma.
Non-perforating. Maybe this correct answer, Dr. Amin, but me interesting as a woman, why non-perforating?
Non-perforating because only there is entrance point and wound canal.
Wound canal and the final information?
Exit.
Bullet
debris absent.
Was extracted from the abdominal cavity.
Yes, ma'am.
So, this correct answer. Dr. Amin.
Yes, ma'am.
In our task, you can see example with non-perforating gunshot injury of the thorax and abdominal cavity with damage diaphragm, stomach, liver, and the kidney.
Yes, ma'am.
If take complications, you can see hemaperitonitis, because look into abdominal cavity present 400 milliliters fluid blood, and this victim is died due to acute post-hemorrhagic anemia, because on autopsy was revealed anemia of inner organs, which is formed due to massive internal bleeding. So this correct answer. Thank you. Next.
The science, special science,
So,
type,
no,
type of
entrance. Entrance wound, science of entrance wound in our task.
okay. Science of round entrance defect, wound defect minus tissue, and a dirt zone, and abrasion.
Yeah, you can see abrasion color. Yes, because grays and from dot red coloring this abrasion zone, abrasion color. As a result, if you can see, Dr. Amin, help me with type action of a bullet. If entrance wound have small rounded form and the present abrasion color,
Cuneiform.
cuneiform. So very good, absolute correct answer. Next, what do you think? A distance of shot, with distance of shot.
This
Why?
distance close, ma'am. It's close.
Closed.
Yeah.
Closed. Why closed?
It's close. We can see colored ring, dirty red colored ring.
Coloring. No coloring you can see in case with cuneiform action of a bullet. Dot color and abrasion color in all situations, as in case with contact, closed, and distance shot. Me interesting. Now I try help you with answering this question.
Okay.
In our task, present information as in history, as at the examination autopsy, information with accompanying components of a shot. This powder gases, soot, gunpowder, present these accompanying components as a wound canal or as on the surface of the skin.
No, ma'am.
No, as in wound canal, this component is absent. As on the surface of the skin, information with tattoo sign is absent. You can see result action, only bullet. Name type?
It's a distance, ma'am.
Distance shot, yes, of course. And they help me, and your girls help with a question, type of firearm, battle or hunting?
It's battle.
Battle. I don't understand why.
It's a rifle because of
Battle, maybe rifle, maybe a combined, maybe. But me interested why battle.
because no tattooing.
Because present one entrance wound, one wound canal, indirect, no problem, but one.
One bullet.
And one bullet, yes, of course. And into abdominal cavity, you can see only one bullet. As a result, shot was a battle firearm. Dr. Amin, thank you very much for the answer. I write 5 today. Thank you. Enough. So, my dear friends, now I have only 1 minute in Zoom program. As a result, please re-enter in Zoom. Is Dr. Krishna. Dr. Krishna, please read your task. Task number 2.
Yes, ma'am. On August 8, soldier, aged 22, was found on the territory of military unit with firearm wound On forensic medical examination of the cadaver, there was revealed in the pilar portion of the occiput from the left 4 centimeter above the occipital tuba and 3 centimeter from its outside to the left. There is rounded with a diameter of 7 to 8 mm. With regular bruise edges. Hair is dirty with a dry and fluid blood. Traces of flame, soot, and powder grains were not revealed. At the place of the left eye, there is an opening of irregular radial form with the sizes of 4 to 3 centimeter with 5 radial dispersed replicas. Wood edges are of irregular form and saturated with blood. Eye globe is absent. On its place, there are distracted tissues apparently saturated with the blood. In the left frontal lobe, there takes place a destruction of the brain, penetrating into the depth with the size of 3 into 3 centimeter along the longitudinal axis of the left cerebral hemisphere through the lateral ventricle of cerebrum, passes wound canal in form of truncated cone, which wide portion is directed toward the occiput. The brain tissue is saturated with blood on all extent. On the course of wound canal, there occur cusped bone fragments of irregular form. At the larger ones are closer to the orbit, and the smaller ones are close to an occiput. On the skull base, beginning from the left orbit, there are 3 wave fissures, one of which ends near the great foramen, where foramen magnum. The second one passes through the middle of the median and posterior cranial fossa, passes on the calvarium and ends near the wound on the occipital bone at the left. And the third one goes aside from the orbit on the calvarium along the left frontotemporal suture and ends near the sagittal suture. In the area of the left orbit, the bony tissue is distracted and bone fragments protrude into the cranial cavity on the occipital bone. At the left, correspondingly to the wound on the skin, there is a round shape opening with split on the external bone lamella. The diameter of the wound is 0.8 centimeter towards and is 1.5 centimeter outside. Diameter, especially near base, is abundantly saturated with blood. Smell of the alcohol was not felt.
So, Dr. Krishna, in your task, present next information. Into skin present 2 defects. First defect in occipital tube, next defect on the left eye. Next. Now I try help you with your questions. So, next main information in our task. No, first, traces of flame, soot, and powder grains were not revealed. First information, main important information. And next, in the area of the left orbit, the bone tissue is distracted and bone fragments protrude into cranial cavity. Next, in occipital bone, in inner lamina, you can see small defects with 0.8 centimeters. External lamina have large defects with a size 1.5 centimeters. So, what do you think, my dear Dr. Krishna, a forensic medical specialist, in your task, this example with perforating or non-perforating gunshot injury? Penetrating. In our classification, Krishan, listen to me. In our classification,
Yes.
present next types: non-perforating, perforating, and tangential. As a non-perforating, as a perforating can be penetrating into body, but main type is non-perforating, perforating, and tangential. So what do you think? This perforating or non-perforating?
Perforating.
Perforating. No, maybe this correct answer, but me as a woman interesting. Why perforating?
But not perforating.
Because
Because entrance into the orbit exit at occupied man.
So, because present two defects into skin and the bones, yes, in occipital and the under left eye. Yes, absolute correct answer. In our task, if take forensic medical diagnosis, basic trauma, this perforating gunshot injury of the head with damage of brain tissue. Complication in our task is absent because basic trauma, this cause of death, because present multiple destruction and damage of the brain. So perforating gunshot injury. If perforating, me and your girls very interesting. Where locate entrance wound, entrance on the left eye or in occipital bone?
Yes.
Where? Mhm.
Like on the entrance and the wound canal, which exit wound where the occiput and the left eye, and small.
Krishna, I don't understand. Repeat localization of entrance wound. On the left.
In the
At
occiput.
least-
Entrance wound in the occipital region.
Entrance wound locate into occipital tube.
And exits on the left eye.
Now in our task present next information. Look, I read. In the area of the left orbit, the bone tissue is distracted and the bone fragments protrude into cranial cavity, into wound canal. Bone fragments go with bullet into wound canal. And if take occipital bone, external lamina, internal lamina present small defects with regular form, external lamina present large defects with irregular form. As a result, on the left eye, present entrance wound or exit wound?
Exit. Wound. Exit.
Bullet, Krishna, listen to me. Bullet go
yes.
inside into body, yes? And then is formed the bone tissue defect. And the bone fragments in place where like it entrance defect. Bone fragments go into wound canal with bullet. In place where like it exit, bullet go outside and bone fragments go outside.
Okay, like entrance and left eye.
Yes, in our task, entrance wound like it on the left eye. And remember, I give you next for exit wound present next specific signs. In inner lamina, you can see small defect with regular form, and the diameter of this defect repeat diameter of a bullet. If take external lamina, defect large with irregular form, and bone fragments as external lamina and the spongy substance go outside with bullet. So as a result, in our task, on the left eye, locate entrance wound, in occipital tube, exit wound. So next, distance of shot. This contact, close or distant shot.
No. Distant shot, ma'am.
Why? This correct answer. Correct answer. Why?
Because like no suit. Because of
Yeah. absent accompanying components of a shot, as in wound canal, as on surface of the skin. As a result, this distance shot. Correct answer? Next, type of firearm. What do you think? This result shot of battle or hunting firearm?
It's battle, ma'am.
Battle. This correct. Don't worry, Krishna. You give me correct answer. Give me full. Why? Why battle?
Because like only one bullet is found.
Because bullet is absent, because you can see example with perforating gunshot injury, bullet go outside. You can see one small entrance wound, next one wound canal, and one exit wound. So understand? Are you understanding? One wound canal, one entrance wound, one wound canal, and one exit wound. In case with hunting, you can see into body, few numerous wounds canal, because into hunting cartridge present many shots. Understand me?
Yes, ma'am.
So thank you very much. Thank you very much enough today for thank you. Thank you. Continue, Dr. Thompson.
Yes, ma'am.
Task number 5, please read this task.
Task number 5.
Yes.
On July 23 at 23 p.m. in village Dukke, citizen T had killed citizen H aged 38. Forensic autopsy has revealed all clothes is wet and stained with clay. A jacket of military breed with the back surface is abundantly saturated with blood, 47 centimeter upward to the very edge of the left skirt. There is a defect of tissue with disheveled edges with the size of 5.5 by 1.5 centimeter. Opposite on the right skirt, there is a defect of tissue with similar edges with the size of 3 by 2.5 centimeter. Defects on the vest and on this shirt coincide those on the jacket from the front. In the chest area at the level of nipples, 2 centimeters to the right of the median line, there is a defect of tissue with the collapsed, scalloped dry edges with the size of 4 by 3.5 centimeter, penetrating the chest. The soft tissues around the wound on the area of 14 by 8 centimeter are saturated with blood. In the right pleural cavity, there is about 1,100 ml of blood with clots of dark red color. On the anterior surface of pericardium, there are 2 wounds with regular edges with the size of 2 by 0.5 centimeter and 0.6 by 0.5 centimeter. In its cavity, there is about 60 ml of fluid blood on the anterior lateral surface of the middle and lower lobes of the right lung. There are 2 wounds with irregular bruise edges and with the size of 2.5 by 3 and 2 by 1.5 centimeter. The 6, 7, and 8 ribs are fractured along the scapular and posterior axillary lines. The fractures are oblique with the involvement of pleura. In the soft tissue surrounding fractures of ribs, there are major hemorrhages, and under the skin there takes place a vast hematoma, respectively to this place. Under the skin of the chest at the right backwards of posterior axillary line, 20 centimeter downwards of the upper border of the shoulder. Joined there are 4 dense hillocks located longitudinally along one course of at the distance of 3 to 2.5 centimeter one after another. At a cut in this area, there were found 4 lead buckshots with a diameter of 0.7 centimeter, a felt wad, and a lot of bone fragments. At autopsy, there was revealed anemia of the inner organs. A strong smell of alcohol was felt from a corpse.
So, Dr. Thompson, me very interesting as me as your girls. Type of gunshot injury in this task, this non-perforating or perforating gunshot injury?
I think this is mainly non-perforating.
Non-perforating gunshot injury. This correct answer. But interesting, why non-perforating?
Because there is no exit wound in this case, and only we can see entrance wound. And mainly we can see it is mainly of a shotgun cartilage, mainly because of the buckshots we can see on different areas. It is not a single bullet, so this is a hunting gun which is used for hunting, mainly that of a shotgun. Since we can see the felt ward and a lot of bronze fragments. I think this is of a close distance gunshot.
Wait,
No,
close distance?
I mean distant shot.
Distance shot.
Distant
Why?
shot.
Why?
Uh,
Why
because,
change conclusion?
no, because of felt ward in the body, there was found the parts of the bullet which is felt ward.
So,
From the corpse. So it is maybe contact or close shot. We can say.
So, first answer, absolute correct. This non-perforating gunshot injury of the which penetrate into chest cavity with trauma of lung, heart, and ribs. Complications in our task present information with pulmonary bleeding and the hemothorax and the hemopericardium, because into pericardium you can see 60 milliliters of fluid blood. And in our task present accompanying changes, this ethyl alcohol intoxication. This correct your answer with type of gunshot injury, absolute correct. Next, hunting. Yes, type of firearm, hunting. Correct answer, because under skin present four back shots and into lung you can see 2 wound canal, into heart 2 wound canal, into ribs few gunshot injury. As a result, this shot of hunting firearm. And I have final question for you. So, in our task, present information with action of fire, with sword, powder gases, with tattoo sign, with chance mark, present or absent?
No signs of
No,
so it is
no. Distance shot, yes, of course. This distance shot because absent information with accompanying components of a shot. Dr. Thompson, thank you very much for your answer. You give me a full correct answer today. Thank you. I write 5 with small minus distance shot. So thank you very much. Thank you. So continue work. Dr. Hisham.
Yes, ma'am.
Your task number 4, please read this task now.
Okay, on February 12th, citizen A, aged 28, was found by his relatives in the bed with a firearm wound of the head. Forensic medical examination revealed the western shirt with numerous blood streaks directed top down. Skin integuments of the face, the anterior surface of the chest wall, the left shoulder with large stains of dry blood. In the right temporal region, 2 centimeters backward from the external end of the superciliary arc, there is wound of trilet form with length of ruptures of 1.5 centimeter, 1.8 centimeter, and 2.1 centimeter. In the center of the injury, at the approximation of skin, there revealed a tissue defect of rounded form with finely serrated edges with diameter of 0.8 centimeter. The wound edges and crushed tissue, which are visible in the lumen of the wound canal, are intensively covered with a blackish deposit. On the left cheek, 4 centimeter from the front of the hucus, there is a slit-like wound with the length of 1.8 centimeter. Bone fragments and crushed tissue are visible in the lumen, and wound canal passes through the right temporal muscle, right pars comoso ossis temporalis, dura mater, right temporal lobe and basis cerebri, optic chiasm, Turkish saddle, and the greater wing of the sphenoid bone at the left. The temporal muscle at the right and the blood streaks are of scarlet color. An opening in pars comosa ossis temporalis is rounded shaped with a diameter of 0.7 centimeter with a dark gray deposit at the site with a width of 1.2 centimeter. An opening on the bone at the right has split on the inner lamella with a diameter 0.9 centimeter. Two fissures with the length of 5.8 centimeter and 3.6 centimeter extended from the primary injury through the temporal bone and end on the frontal and parietal bones. The right temporal lobe is destructed. On section, it is seen sulcate canal with the width of 4 centimeter, which passes to the basis cerebri in the area of Turkish saddle, and in the anterior cranial fossa at the left there is manifold or small fragments, at which approximation it is noted a round shaped defect with the split on the external lamella with diameter of 1.3 centimeter on greater wing of the sphenoid bone at the left. Pia matter is abundantly saturated with blood. From organs and cavities of the corpse, the smell of alcohol is felt. On inspection of the gun, it is revealed. At the beginning of a bore in the area of gun point, cut their doe spots resemble body, dry fragments of brain tissue, and 3 short light brown hairless.
So, Dr. Hisham, help me and your friends with type of gunshot injury in our task. What do you think? This perforated or non-perforating gunshot injury?
It is maybe non-perforating.
Non-perforating. Wait, Dr. Hisham. Now I read next information. In the right temporal region, present defect of the skin. In the left cheek, present defect of the skin. And between these defects, locate wound canal. Into skin, present 2 defects. If take non-perforating gunshot injury, you can see only 1 defect into skin and wound canal, and bullet locate into body. So,
okay, so it may be perforative.
Maybe concrete answer. This
Perforating injury.
gunshot injury. Yes, because you can see 2
It has
yes, present as the entrance, as the exit.
Entrance and exit wounds.
Yes. So, if write a basic trauma, you must write next information. Perforating gunshot injury of the head with damage of the brain. In our task, complication is absent because that's very, very quickly coming due to trauma of the brain.
Trauma of the brain.
Yes. And help me with localization of entrance wound. Where locate entrance wound? Because in our task, I repeat, present defect into right temporal region and into left cheek.
So, what's the question, ma'am?
Entrance wound. Entrance wound locate into right or right temporal region or into left cheek.
Left cheek.
Yeah. Why?
Because or right region.
Look.
Region.
Look, in this situation, I'll task present next information, no, as a for me important. In the right temporal region, 2 centimeters backward from the external end of the super arc, in center, this injury, you can see the fact rounded form, regular rounded form with abrasion zone. In ages, abrasion zone present. Next, the present information, the wound ages, crushed tissue with are visible in the lumen wound canal, intensively coated with blackish deposit. If take left cheek, in this situation, in this place, you can see a wound with slide-like form, irregular form with length 1.8 centimeters. Please, what do you think? Where locate? Repeat answer. Where locate entrance wound? Where locate exit wound? If in right temporal region, wound have regular rounded form. In left cheek, slide-like form, irregular form. And edges go outside in the left cheek.
The right side will be entrance wound.
Yeah.
Right temporal region. Yeah. And the left cheek will be exit area.
Exit. Yes. This correct answer. Correct answer. In our task, in the right temporal region, present entrance wound, in left cheek, exit wound. Yes. And in this situation, present no specific information for exit wound. Ages go outside. So help me with distance of shot. This contact, close or distance shot. What do you think?
It may be closed.
Remember, I repeat, read next information. The wound age and crushed tissue which are visible in the lumen into wound canal are intensively covered with blackish deposit. You can see in wound canal soot, because soot is a substance which black color, which is formed due to gunpowder at shot. If components of a shot locate into body, into wound canal, name type of distance. This contact, close or distant shot.
Then distant.
No,
I think close.
No,
close.
I'm going to cry. Hisham, listen to me. I repeat this information because this question present in our module. And other students, listen to me. If take contact shot, all components of a shot go into wound canal, inside, into body with bullet. And you can see the intensively covered with blackish deposit wall of canal. And if take closed shot, you can see a components of a shot on the face of the skin. Yeah, and around of entrance wound on the face of the skin. If take distance shot, A component is absent because very, very long distance. You can see action without action, only bullet, only without a components of a shot. And final question, type of firearm in our task. This battle or hunting?
Battle.
Battle. So why battles is correct answer?
Because
because present one entrance wound,
one entrance wound and one exit wound.
Yes, and wound canal, one wound canal.
Penetrating canal, yes.
Yeah. So, Dr. Hisham, please repeat this topic. Repeat, because today you give me a correct answer, but with my help, I write for. Thank you. Repeat this topic. Thank you.
Okay, ma'am. Thank you.
Dr. Jones.
Yes, Harry Mike.
So, Dr. Jones, task 6, please read this task.
On October 8, a corpse of citizen K with 2 gunshot wounds has been found in room on the bed. On the table in the room, there were 2 cartridges to the pistol TT and 1 cartridge to the revolver. On the floor near the door, there was revealed a case. On the wall near to the entrance, at the distance of 15 centimeters to the ceiling, there is a hole resembling a firearm one. Forensic autopsy has revealed the presence of star-shaped wound 2 into 0.7 centimeter with 4 ruptures with the length from 0.3 to 0.8 centimeter located 3.5 centimeter below the left angle of the mouth. Along the edge of the wound, there is a dark gray ring 0.2 centimeter wide. At approximation of the wound edges, they form a tissue defect. On the posterior surface of the neck, 1.5 centimeter to the left of the median line, at the level of the 4th cervical vertebra, there is a slit-like wound with irregular edges and 3 ruptures with a size of 1 into 0.8 centimeter. Wound edges are turned inside corniculum of the thyroid cartilage, turn inside out. In the soft tissue of the left submandibular region, there is a vast hemorrhage of dark red color. The left corniculum of the thyroid cartilage is broken, and the border of the fracture are saturated with blood. There are diffuse hemorrhages on the mucous membrane of the epiglottis and pharynx. At the left of the posterior ward upper respiratory tract, there is noted the presence of mucus fluid with the blood. In the area of the left neurovascular fascicle, there is a vast hemorrhage. On the anterior wall of the carotid artery, at the point of the origin of the common carotid, there is a tissue defect of the irregular round shape with the size of 0.6 to 0.7 centimeter. On the anterior surface of the 3rd and the 4th cervical vertebrae along the left edge, there is a bony defect with size 2 into 1.5 centimeter. Fracture of transverse process of the 3rd and the 4th cervical vertebrae takes place on the border between bodies of 3rd and 4th vertebrae. At the left, there is a bony defect of the triangle form with a size of 0.6 into 0.8 centimeter with bone fragment directed outside. At post-mortem examination of the spinal column, there was revealed hemorrhages above durameter of the spinal cord at the level of 2 to 4 centimeter vertebra.
So, please, Dr. Jones, help me with the question. Type of gunshot injury. This non-perforating or perforating gunshot injury?
It is non-perforating because edges go inside.
In our task present next information. No, I see this information. In the area left angle of the oral cavity present wound with a star-shaped form, with ruptures, with ring, dark gray color 0.2 centimeters, and on posterior of the neck surface present defect tissue too, with irregular edges, with irregular form.
Yes. So
As a result, into skin present to defects, to wounds.
so perforating.
Perforating. Yes,
Yes,
in our
true.
task, you can see example with perforating gunshot injury. Because first a wound located in left angle of the mouth, and the second defect located on posterior surface of the neck. So with irregular form. So help me with distance of shot. What do you see?
It is star shaped, so contact.
And this correct answer. First sign, specific form as a star shape, because you can see action as a bullet, and the powder gases. Remember, powder gases have a mechanical action. Due to action powder gases, in our skin is formed ruptures.
Yes.
So next, in our task present next information, what is it? Listen to me. Along the edges of the wound, there is a dark gray ring, 0.2 centimeters. What do you think? Around of this injury, present zone with a dark gray color. This, if they contact, if they contact.
Yes, it is shat sign abrasion.
Yeah, the Stanzmark. Yes, this abrasion, this imprint as an abrasion, yes? This sign named Stanzmark. Stanzmark is in our task, this second specific sign for contact shot. So next, very interesting in our task, present example with battle or hunting firearm.
It is a battle.
Battle, why?
Because pistol.
Yes.
One wound canal.
Or one wound canal.
One penetrating.
Yes, penetrating, and one entrance wound and
one exit.
Yes, simple question, because in our task present information with pistols. Yes, thank you. Jones, I write today 5 with small minus.
Okay.
Repeat this topic.
Okay.
So, my dear friends, I have enough. Thank you. I have only 1 minute. Please re-enter in Zoom